All right, hi you guys. So this is the GIGU portion of the head to toe assessment, okay? Like I've been saying before, whenever you walk into that patient's room, you want to make sure you wash your hands, okay? Put your gloves on and introduce yourself. Hello, my name's Courtney. I'm going to be your nurse today.
Hi,
Hi, do you mind telling me your name and date of birth, please?
Ruth A. Davila, 31134,
Perfect. And Ruth, do you know where you are today?
Samaritan Hospital.
All right, perfect. And do you know what date it is?
Tuesday.
Thank you. Do you have any allergies that you know of, Ruth?
Not that I'm aware of.
Okay. And are you feeling any pain right now, Ruth?
No pain.
Okay. All right. So for the abdomen, you do want to inspect it first, okay? And this is not palpation, okay? You always want to make sure you palpate after you listen, okay? Because if you do palpate that abdomen and then listen, you can create some false bowel sounds, which we do not want, okay? So I am just looking at the abdomen, okay? I do not see any wounds. You know, the skin looks intact. You can use your pen light and kind of look at the contour of the abdomen. If you actually look nice and close, I don't know if you guys can see in this view, our patient here, it does look like she has an umbilical hernia because there is a little bulge there, but not too concerning, okay? That's just, she knows she has it. It's normal for her, we'll say, okay? All right, so inspected the abdomen, coloring looks great. Everything is within defined limits, okay? After we do inspect, then you want to listen. Like I said, you do not want to, as tempting as it may be, you do not want to palpate that abdomen prior to listening, okay? You're going to use the diaphragm, okay, of your stethoscope, and you're going to make sure you listen to all 4 quadrants, all right, for bowel sounds. And it is, if you do note an absence of bowel sounds, you actually have to listen, believe it or not, for 5 minutes to that site to declare that there are not any bowel sounds present, okay? We'll say that our patient here, you know, is hungry, waiting to eat. I'm hearing a heck of a lot of bowel sounds right now, okay? Perfect. All right, so we listened, we heard, we'll say hyperactive, right? She's, you know, really going there. Bowel sounds, so we can now palpate the abdomen, okay? In a similar fashion, you're just gonna kind of feel around, okay? I'm feeling for any kind of masses, pain, okay? So if she, you know, abruptly kind of says, ow, ow, definitely concerning, okay? Or any kind of, you know, warmth, okay? So same kind of fashion, you're gonna palpate the abdomen. Again, always do this after you listen, all right? So we palpated the abdomen. She said no pain, you know, she's feeling all right. I didn't feel any masses, okay? Now, from there, I am going to ask Ruth, when was your last bowel movement?
2 days ago.
2 days ago, okay. And how did it appear to you? Do you have any difficulty going to the bathroom, or?
It seemed pretty normal. I just feel like I need to drink more water because I haven't really had a whole lot of water recently.
Okay, yeah, that can be common, unfortunately, when you're here. So we'll make sure that you get nice and hydrated, okay, and we'll keep an eye on that. When's the last time you urinated?
Right before you came into my room.
Okay, all right. Do you use any devices at home for either of those, for both bowel movements and when you have to urinate?
Sometimes I wear a pull-up.
Okay, so sometimes you have accidents every once in a while. Okay.
Very little.
Okay. Do you eat most of your meals when you eat?
Yes.
You do, okay. If you had to give it like a percent, like 25% of the meal, 50%, 100, what would you say? How much percent?
I would say most of the time it's just about everything because I don't like to waste food. So I'm usually pretty good with eating everything that's on my plate.
I hear you, Ruth. Me too. Sometimes 110%, right, of my meal. All right. Also, too, Ruth, when you do urinate, what color would you say it is?
Most of the time it's yellow.
Yellow, okay. Like a lighter yellow, or?
In the morning it can be a little bit darker, but as the day goes through, it lightens up.
Okay, that makes sense, right? Because you're not drinking at night. All right. Any questions for me, Ruth?
No, I don't think so. Thank you so much.
Yeah, thank you. All right, you guys. So that is the conclusion of your GIGU assessment.